Thank you very much, Scott. It's lovely to be here, and thank you for having me. To everyone out there as well, thank you for joining this presentation. As Scott mentioned, my name is Greg Morling. I'm a remedial massage therapist from Sydney. My presentation will cover the theory underpinning some new gentle massage techniques aimed at treating a dysfunctional iliopsoas muscle. The iliosoas is sometimes called just the psoas, but I refer to it throughout my presentation as the iliosoas. This presentation will take around about 30 minutes, and I truly welcome any feedback or questions that you might have relating to my work. One of the most enigmatic muscles in the human body is the iliosoas. Travell and Simons name it as the hidden prankster, and I suspect that a significant number of massage therapists are puzzled about how to manage this prankster in the clinical setting. Just like one of Pablo Picasso's Cubist paintings, it possesses many angles and ambiguities that makes it fascinating and profoundly difficult to address and treat in our practice. Some of the conditions involving the iliosoas muscle include lower back pain, sacroiliac pain, sciatica, disc trauma, scoliosis, hip and knee pain, menstrual pain, and digestive problems. We may also include biomechanical problems including pelvic tilt, leg length discrepancies, kyphosis, and lumbar lordosis. This presentation will cover a range of issues associated with the iliosoas, including the different views surrounding the function of this muscle, the relationship it has with so many other parts of the body, and its role in initiating the fear reflex in your client. Next slide. Position. The psoas major, psoas minor, and the iliacus muscles combine to become the iliosoas. The psoas minor is present in roughly 40% of the population. If present, psoas minor assists in a superior rotation of the pelvis, an action opposite to psoas major. Psoas minor is a vanishing muscle, disappearing as we evolve from a semi-flexed to an upright being. Psoas major and minor both insert together on the lesser trochanter of the femur. There are two psoas major muscles attaching to each side of the transverse processes of all lumbar vertebrae, L1 to L5, and the bodies of T12. All lumbar vertebrae are innervated by branches of the L1 to L3 lumbar spine nerve roots, and there has always been an anecdotal relationship between the iliosoas dysfunction and inguinal pain. Iliacus originates in the superior two-thirds of the iliac fossa and the anterior ligaments of the lumbosacral and sacroiliac joints, and insert into the lesser trochanter of the femur. Move to the next slide, please. Function. Iliosoas is considered by most therapists to be the main hip joint flexor. It flexes and laterally rotates the thigh, exemplified in kicking a football. The iliosoas muscle works in tandem with iliacus, rectus femoris, pectineus, tensor fasciolata, and sartorius. Acting from its insertion at the lesser trochanter of the femur, it flexes the trunk, such as in rising from a supine position. As well as flexing the hip, the iliosoas muscle can assist extension of the lumbar spine, increase lumbar lordosis, and it plays a significant role in maintaining upright posture. Many would also argue that a dysfunctional iliosoas contributes significantly to back pain. Ida Rolfe wrote that the psoas does not bulge forward, it lengthens and falls back within the abdomen as it flexes. There is some controversy here concerning exactly what the iliosoas muscle achieves when it flexes, and perhaps the question is whether the iliosoas muscle is contracting and lengthening at the same time by utilizing individual fibers within the one muscle. Thomas Myers offers a similar suggestion in his writings on this enigmatic muscle as well. In his opinion, the iliosoas is a major flexor of the hip and may well be operating on the lumbar spine as one muscle, but with opposing functions and forces within it. not unlike the deltoid that engages one or all of its three compartments during movement. Professor Nick Bogduk, an Australian researcher from Newcastle University, has been the major influence